All right, everyone. I can't believe it's March already. Happy Friday. Thank you for tuning in. If you're just joining us, I'm Dr. Jay Kim. I'm a facial plastic surgeon in the Washington, D.C. metro area, specifically in Fairfax, Virginia. I'm here today on this lovely Friday afternoon at Downtime Salon and Wellness Spa, where I also see patients and perform treatments including injectables like Botox and fillers, as well as microneedling and other fine facial treatments for your facial beauty. So for today's live, we're going to be talking about jawline slimming. Please follow my account at JKimMD Facial Plastics on Instagram, at JKimMD on Facebook, as well as Dante Salon and Spa on Instagram and Facebook. Please like and text the word slim to 703-705-2100. That's our office number. And you will be entered to win, for a chance to win a free lower Botox treatment to slim your jawline. Okay. Before we begin, I have a few important announcements. First, I would like to welcome the newest member of our facial plastic surgery office team, Miss Adriana Roberts, otherwise known as Dree.
Thank you.
This is her first week at the office. She's a very friendly face. She has extensive experience in sales, and she's also a drummer, so she's quite the rock star. So we're very glad to have her on board. Secondly, in other news, Nala got fixed about a week and a half ago. She is doing well, and she still has a lot of energy, which is very fun for all of us at the office and for my wife and me as well. On a more serious note, I would like to mention the horrible incident in Atlanta on Tuesday, leaving 6 Asian Americans dead and 2 others as well. I'm not the most eloquent with words, and I'm sure you've seen many other news outlet articles and social media posts highlighting this issue. My stance as owner of JKimMD Facial Plastic Surgery is that we will not tolerate hate against people who are different than us. We at my office seek to treat everyone equally. Okay, we appreciate our cultural differences, and depending on some differences in anatomy, how I tailor your treatment may be a little different based on your race. But besides that, regardless of race, culture, gender, creed, sexual orientation, or any other category, my job and my team's job is to treat you with respect. So with that said, we'll get into our jawline slimming talk. So in terms of jawlines, they are all the rage. I think that through COVID-19, a lot of us have spent more time in front of a camera or a video screen, namely Zoom or FaceTime. And to be fair to our own facial structures, these cameras can warp our fisheye what really our real shape is. So oftentimes on an iPhone camera or on your laptop camera, things may be a little distorted. But with that said, a lot of people, the more time you spend in front of a camera, you realize, hey, my jawline isn't, there's shapes that I didn't notice that were there before, or, it's not straight, it's kind of got a little curve to it, or it's ill-defined. There are many issues that patients come to me with regarding the shape of their jawline and how they feel like, oh, I don't like this part of my jawline, I would like it changed. So there are different ways of volumizing or slimming down your jawline depending on your goals. If you think about celebrities in Hollywood whose jawline you would be envious of, when it comes to females, somebody like Angelina Jolie comes to mind, and some of the features about her jawline is that she has, from her chin to the angle of her mandible, a really straight and defined line. And that's, very beautiful. And also at the angle of the mandible, there's a discrete shape right there, which unfortunately I don't really have, so I can't show you in person. But if in your mind's eye, you know what I mean when it comes to an ideal jawline. For us men, you can think of certain athletes, including Tom Brady, maybe David Beckham or Cristiano Ronaldo, where it's just a straight line from here, and bam, bam, you get that nice angle. Okay, so for females, the ideal jawline is a little bit slimmer than for males. So we're going to talk mostly about slimming and tightening today. So we'll start with Botox for your jawline. Now, you know about Botox and how it relaxes your lines on the upper face, but we can also use it to shape your jawline. So it works by relaxing this chewing muscle along the side of your cheek. Now, how long does this last? It lasts about 4 to 6 months. And the downtime and recovery time is pretty minimal. You'll start to notice a weaker chew from your jawline about 2 to 3 days after the procedure, and it lasts for about 4 to 6 months. I do this on myself, and it's been a while since I've done it, so I did a poll on my Instagram stories earlier today asking if I should do it on the live, and an overwhelming percentage of you said yes. So stay tuned until the end, where I'm going to inject myself with some neurotoxin to slim my jawline. Okay, now the next treatment you might have heard of is Kybella. So Kybella is an injection that's performed in the office. It's a liquid that we perform tiny injections along areas where there's undesired fat. Kybella works by melting away fat. And in particular, it's really good for right under the chin, just between the front of your chin and your neck. Okay? This is good for areas of superficial fat. This is fat that you can grasp between your 2 fingers, under your jawline, or under your chin. So how long does that last? Well, assuming you have a lasting effect, it'll be good for the rest of your life. It does, however, take 3 to 6 treatments. It is quick and performed in the office. You can expect some swelling from the Kybella over several days. And if you need another treatment, usually we come back at around the 4 to 6 week mark afterwards to decide if you would like some more. When it comes to tightening along with slimming, you have microneedling with radiofrequency. So microneedling with radiofrequency has 2 technologies that work in your favor. The first is microneedling. So as you may have seen, microneedling is a bunch of, we use a head of 49 needles, which stamps the face in the area of treatment. And what that does is it creates a controlled micro injury at a certain depth. By doing so, it activates your body's collagen-making processes so that the fullness and volume of the area is restored. Now, you might say fullness and volume, why would I want that? Well, as collagen forms with this controlled injury, it forms in a more organized fashion so that the shape and structure of the jawline and lower face become better. At the same time, if you add radiofrequency heat to your microneedling, what happens is that the heat, as the needles get stamped into the area of treatment, it releases heat, which makes a shrink wrap effect. And when heat encounters skin and soft tissue, it does a little bit of that. Kind of like how you would see food in a microwave. Sorry, I don't want to equate radiofrequency to a microwave, but you get the idea. So during that split second when the needles are entering the area of treatment, you get delivery of heat as well, and that helps to shrink wrap things just that little bit. And for those of us who have a tiny bit of saggy, I'm talking about like 30s into 40s age group, that can be a nice change for you. Okay, now lastly we come to probably the most invasive that I'll talk about today, which is liposuction. Okay, when it comes to the lower face and the jawline, what happens is that the fat distribution changes over time, and what you'll notice is that more superficially you notice fat compartments, and you can sometimes notice it in the form of jowls or in the form of this chin fat slowly drooping down. Okay. When this area is not so drooped down or not so remodeled that it can be changed with liposuction, it's a very worthwhile procedure to do. I actually did this on a younger patient the other day. This patient was in her mid-30s and she wanted a little more definition right along here, and she didn't have much fat to remove, so liposuction alone actually was a good option for her. The downtime and recovery time initially can be about the same as for Kybella. So you're definitely sore for a few days and it's swollen. And at home you wear a chin strap for most of your awake hours and while you're asleep, except when you shower. In terms of, the difference between Kybella and liposuction is that you might need several treatments of Kybella versus usually with one liposuction treatment, you're good for a while. Okay? At this point, if there are any questions from the panel or from the audience, I'd be more than happy to answer.
A user asked, how long does each procedure take?
So lower Botox is probably the quickest of them all. Just like with an upper Botox injection in the office, it takes about 10 minutes from when the Botox is prepared till the time of injection. And then I perform a series of 3 injections along each cheek, which I will do in a few minutes. These are deep injections, and each one takes about a few seconds. So from the first to last injection, probably about a minute or less. When it comes to Kybella, there's a little bit of preparation, including a marking grid that is provided along with the Kybella to place along the chin or the area of treatment. And there's a series of about 20 to 30 injections based on the size of the area you want to treat, so probably about 15 minutes. For RF microneedling, it does involve numbing, so you want a numbing cream on your face for about a half hour, plus or minus injections along certain nerves that provide sensation to your face. The microneedling RF procedure itself, from the first stamp to the last, probably about 15 minutes depending on your area of treatment. If you're focusing just on the chin and jawline, probably would take about 5-10 minutes, but if you would like to treat the entire face and neck, probably about 20 to 25 minutes is ideal. For liposuction, from the beginning to the end, you're going to be numbed up, and it's basically a surgical procedure performed in the office. So, you come to the office, we go over your goals again, and we mark the areas that we need to focus on to do the most liposuction. Then we numb it up, we prepare it like a surgical field, and then we perform the liposuction. Since it's a relatively small area of the body, usually about 10 or 15 minutes we'll do it, and then we put a small stitch into the port, into the incisions through which the lipocannula was delivered, and we put on a dressing and you're ready to go home. So probably from incision to time you go home, probably about half hour.
Mm-hmm. Also, a user asked, who is a good candidate for liposuction?
So a good candidate for liposuction only is someone preferably younger, like 45 or younger, who has excess amount of fat without much in the way of skin laxity. So you can test how much lax skin you have by this, and if it bounces back well, you're probably a good candidate for liposuction. If you have saggy skin along with excess fat, you're probably better served with a more extensive procedure such as a mini facelift or a full facelift.
Also, a user asked, how many treatments of Kybella will I need?
So that is a very good question. Depending on how tenacious the fat is under your chin, it can take 3 to 6 treatments. Keep in mind also that this is fat that is superficial to this muscle called your platysma. There is fat that is deeper than that muscle, which the Kybella can't really treat reliably. So make sure that your provider or injector knows that you're a good candidate for the Kybella. It can take 3 to 6 treatments. I've treated people up to 3 times with some change. And at that point, the patient decides whether they would like to pursue more aggressive change or whether they would like to stop there.
Okay. Which do you recommend for best results?
It really depends on the issue at hand. So there are different anatomical features in each region that can be changed. With regard to this back third of your jawline, it's really the muscle that defines your jawline shape. So therefore, if you want to change this area, the Botox would be the best treatment for that to slim the overall profile. If you want to volumize this profile, however, or define this angle more, fillers actually would be a good way to treat that. Now, for lack of time, we'll talk about jawline volumizing at a different date. But for slimming, definitely Botox in this area would be the best for you. In terms of the middle third and the front third, it's really an issue of fat around this area and around this area. So if the fat you feel like is superficial, then Kybella is a good treatment. It's relatively quick. Do keep in mind that the downtime is a little more than you might expect because of the swelling that occurs underneath your chin. For a little bit of laxity, along with a little bit of fat, then microneedling with RF will give you a good tightening and a change. But for more tenacious fat that doesn't go away with Kybella, liposuction is your answer.
Can Botox help with teeth grinding?
So that's an awesome question, and people come to me to ask for lower Botox for those 2 reasons. Sometimes some people say, oh, this area is too wide, and so we treat with Botox for that reason. Other people say, I can't tolerate how my teeth grinding at night makes me feel sore in the morning. And that's initially why I started it, but for either or both reasons, the Botox treatment to this area is really good.
Okay. Seems as if there's no further questions, Dr. Kim.
Mm-hmm.
Let's get started with self-treating.
Okay. So I'm right-handed, so this right side is going to be a little bit easier. I already wiped myself with alcohol, so here it is. Okay. So the amount of Botox we use for this treatment is a lot more than for the upper face muscles, because this muscle is much stronger and much bigger. So we're going to do 3 injections. This goes deep into your muscle and out and in and out. And last one, just below your cheek arch. Okay, that's it. I have a couple spots that will hold with some pressure. Okay. And I guess we have time for the left side too, huh?
Mm-hmm.
Okay. All right. So in terms of pain, I would say it's a 1 out of 10. And some of the discomfort occurs when that amount of liquid has entered the muscle. So right now, I'm able to stretch out my chewing muscle just fine, okay? And it'll be a little sore for maybe the next 30 minutes to an hour. But after that, I should notice a nice change in terms of the teeth grinding at night. So I'll be less sore in the morning, and also the side benefit is that you'll have the slimming effect. So actually, I sent a selfie to my brother a month after my previous treatment, and he asked if I had lost weight. I actually had not lost any weight, but I had just done Botox. So I said, no, I didn't lose weight, just Botox. So yeah, we had a good laugh about that. Okay, so it's time for the left side, I guess. Okay. So as you can see, it was very quick, that right side. And the left side should be just as quick also. Let's just get the air out of the needle. Okay. So I clench my teeth to see where the bulk of the muscle is. Okay. So we'll go from here. And next one. And last one. Okay, that's it and that's all, folks. All right, so if you have any other questions, please text or call the office. Remember to text the word SLIM for your chance to win this treatment. Like and follow us and Dante Salon and Spa as well. Again, have a great weekend, and we look forward to the next time. We are taking suggestions for what you would like to hear about next. We can do jawline volumizing, or we can do injection rhinoplasty. So again, take care, have a great weekend. We'll see you next time.